Welcome to the MedEvidence podcast, hosted by Dr. Michael Koren and Michelle McCormick. MedEvidence, where we help you navigate the real truth behind medical research with both a clinical and research perspective. In this podcast, we'll have discussions with physicians that have extensive experience in patient care and research. How do you know that something works? In medicine, we conduct clinical trials to see if things work. Now, let's get the truth behind the data.
My name is Dr. Michael Koren, and I'll be the host today, as well as a participant for our MedEvidence Hour. And I'm just so delighted to have my good buddy, my research colleague, and the best gastroenterologist in town sitting side by side, Dr. Bharat Misra. He's just a tremendous resource for our town. And he's been growing this beard that makes him look like a guru that I would meet on top of a mountain. So I think his words will be really insightful today. So Bharat's a good friend, and we're going to have some fun over the course of the next hour talking about liver disease and fibroscanning. So Bharat, maybe you can just kind of start us off by just giving us like a real overview on should people be worried about liver disease, what's cirrhosis, and tell us a little bit more about it from your perspective as a gastroenterologist.
Thank you, Mike, and I second the sentiment. I'm looking forward to a very engaging and hopefully informative session. So first, the liver is a very critical organ. You cannot live without your liver, and we got only one liver. And the other problem with liver disease is, until it's very advanced, it does not cause any symptoms or signs. So typically, by the time you have symptoms, it's already quite too late. You have advanced liver disease. And this is what makes liver disease very challenging. It used to be after the 60s and drug use, hepatitis C was the big liver disease in the United States. Now hepatitis C is waning, partly because drug use is down. We have better treatments. But now we are faced with another liver disease called fatty liver. Mm-hmm. So liver disease has always been around with us, and it's just that what causes the liver damage is increasing. So in the United States, increased deposition of fat, fatty liver, alcohol, and hepatitis C would be the top three liver diseases.
And just to clear the air on hepatitis C, we have drugs that pretty much have eradicated that, or how far along are we in getting rid of hepatitis C?
So the treatment of hepatitis C is a true miracle of modern medicine. And we at Boll & Groover and ENCORE participated in some of the pivotal trials. Right now, we have several oral medications taken for 8 to 12 weeks, which have cure rates approaching 98%.
Beautiful.
With minimal side effects. So theoretically, you could eradicate hepatitis C in the world if everybody could afford the medications.
So researchers have solved hepatitis C, and now our focal point is on fatty liver as the next stage in terms of preventing end-stage liver disease.
That is correct. I think all hepatologists and researchers can pat themselves on the back, but we got to look to the future. There is another 800-pound gorilla in the room, which is fatty liver.
Terrific. So one of our focal points today is fibroscanning. And we find this a very interesting piece of technology that most people have never heard of. And there are some interesting reasons why people have never heard of it, but it's a technology that we have used extensively in the research environment. And we're fascinated by the fact that it has not spread into clinical practice very well, and that this technology that is in the research environment is something that maybe more people should be able to access. So why don't we tell the audience a little bit more about what is fibroscanning and why we're having such a hard time getting it to the general population?
Sure. I think that's a very important point. But before that, I want to tell people, how do we diagnose liver disease in the first place? You don't have any symptoms, and signs are very late. So typically, you need some imaging of the liver. And traditionally, we have used an ultrasound, which is a good test. And then we go on to more invasive tests like CAT scans and MRIs and even a liver biopsy. All these 4 imaging modalities are very commonly available. Unfortunately, they tell you that you have fat in the liver, but they don't tell you how bad it is. And for that, you need either a liver biopsy, which is very invasive, or an MRI, which is very expensive. Well, it turns out that there is actually a very uninvasive, simple, inexpensive test that has been around for decades, and that's called a Fibroscan. It's similar to an ultrasound as far as doing it is concerned, and it tells you the two most important things you need to know: how much fat you have, how much scar tissue you have in the liver. And with these two pieces of information, any gastroenterologist, hepatologist, or any physician interested in fatty liver can stage your disease and develop a treatment plan for you.
So for the audience standpoint, let's just explain that Fibroscan is actually a trade name.
That is correct.
And the actual technology is called ultrasonic elastography.
That is correct. So basically they use sound waves to shake up the liver and see how much it moves. That's kind of a layman's term of what Fibroscan really is. And Fibroscan is a brand, and it's been around the longest. In research and in clinical practice, they have, we think, the best device.
And I guess, the physicist in me is going to come out here for a second, so indulge me, please. But what it's really doing is looking at the speed of the ultrasound wave in different types of tissues. And in harder fibrosed tissue, it's going to move slower than a nice, soft, pliant tissue.
That is correct. That's actually the mechanism. And it came out of a PhD project, and the guy who wrote the project actually developed the company called EcoSense in France. And it's become the most widely used instrument to measure fibrosis based on the principles you've talked about.
And I guess just also help people understand, unlike a standard ultrasound, you're not creating a picture of a tumor or bile ducts per se, but you're really just looking at tissue characterization. So a Fibroscan does not replace a standard ultrasound of the liver. Would that be accurate?
That is correct. Yeah. I think Fibroscan is complementary to all these other tests that physically look at the shape of the liver. Fibroscan is kind of a one trick horse, but it does that very well. So going back to the original question, why are there many more MRIs in Florida and in the United States than an inexpensive Fibroscan?
So just for the audience, we looked this up right before the program, and to elucidate the audience about how many Fibroscanners are in the entire state of Florida based on our current research.
I believe it's about 14 or 15.
And you have that many MRIs in your basement, don't you?
Yeah. In Jacksonville, but it's one of the quirks of American medicine is that a test that costs upwards of $800 is widely prevalent. On the other hand, a test that costs $50 is not available. And I think that boils down to how institutions and physicians are reimbursed. The reason we have only 14 Fibroscans and a gazillion MRIs is because of reimbursement. Doctors and staff who do this are not reimbursed adequately for buying the equipment, which is very expensive. So because of that, we tend to shy away from owning a Fibroscan.
Now, there's no downside to fibroscanning. It's not like radiation or anything that can damage your liver or cause any complications to your knowledge. Is there?
No. Fibroscan is a very safe test. Its safety profile is very similar to an ultrasound.
Right. So for CAT scanning, for example, things that use radiation, there is some concern about overutilization of the technology for individual patients because of side effects, that would not be the case at all for fibroscanning or ultrasound in general.
Yeah, I believe that is correct. I think an even more accurate comparison is there are only two other tests that tell you the information you get from a Fibroscan. One is an MRI of the liver, and the other is a liver biopsy. MRI is safe, but very expensive. A liver biopsy is somewhat risky and very expensive. On the other hand, Fibroscan gives you very similar information at low risk and low cost.
Any comments about the accuracy of fibroscanning?
So in general, a liver biopsy is considered the gold standard. Looking at a tissue under the microscope is almost difficult to replace that. After that is an MRI, but Fibroscan is a very close third. For the amount of information it gives you, it is approaching in accuracy to an MRI. And that's why it's the study of choice in clinical trials.
Now, one of the important things about fibroscanning for the technology to work is that the beam that's being used, the wave that's penetrating your liver, needs to go directly from your skin to pretty much touch the liver. And one of the concerns is if people have other stuff in the way, can that interfere with the accuracy of the test?
Yeah, so if you have a foreign body like a pacemaker or a pain pump in the area, that would interfere. Another concern is that individuals are very overweight and have a significant amount of fat on their abdomen, what we call the orange distribution of fat. That makes the Fibroscan a little bit less reliable. So that is typically after a BMI of 35. That is a limitation to Fibroscan.
And so, from my understanding, is that there is some technical expertise required. So, for example, if it's an obese patient, you may have to find the right window to get good information from the liver using fibroscanning.
That is correct. Then you have to go and look at other ways of reaching the liver. And most of the people who do this for us have done dozens of these exams. They're fully trained, and they can usually find a window.
Okay, so you convinced me fibroscanning is almost as good as mother's milk, almost. Less likely to cause fatty liver than mother's milk, by the way. But so the question is, who should get a Fibroscan? And I think it's a question that we need to think about and get to in the next segment.
Thanks for watching the MedEvidence podcast. To watch the rest of this series, head over to medevidence.info or subscribe to our podcast on your favorite podcast platform.